Let's start. Yes, let's start, because we're tight in time. Welcome, welcome. In this session where we're talking how to improve the quality of life in atopic eczema beyond the physician consultation, and startup. But let's introduce. Atopic eczema is much tougher on patients than people understand. It seriously impacts patients' lives beyond their skin. They don't just have atopic eczema, it almost always restricts life, impacts mental health, and leads to the development of other diseases. And these are the messages arising from EVA Itching for Life report, the biggest survey ever of quality of life in atopic eczema in last 2018. This event goes beyond the surface of atopic eczema and aims to present and understand the view of patients and specialists on how to improve the quality of life of people with atopic eczema beyond the consultation with the physician. We're talking about everyday life and through multidisciplinary care, and that was in fact the key ask arising from the Itching for Life report. This event continues the celebration of the second World Atopic Eczema Day, an annual awareness event last 14 September, with theme this year Beyond the Surface, bringing patients and specialists together. The event is organized by EVA in full partnership with Global Skin, the two umbrella organizations for national patient groups on atopic eczema. Let's start. As I told, the time is very tight, and I have to be unpolite. I give a warning to the speakers, 2 minutes left, and to the panel, 5 minutes left. Let's start with Giuseppe Carlo. He's Director of Operations and Projects at EVA, and he works in the implementation and management of national and European projects since 2011. Welcome, Giuseppe.
Thank you, Erna. Thank you, everybody, for being here. So as Erna was saying, this session of today is a natural continuation for us of the work that we started to do a couple of years ago with the publication of our report, Itching for Life, and I want to give you some highlights of our study. It was the biggest study on atopic eczema quality of life involving 1,200 patients in nine countries. We asked, first of all, about the management of the disease, starting from the diagnosis. So we found out that diagnosis is generally done by general practitioners and dermatologists, although there are differences in some countries. For example, in Sweden, general practitioner is much higher, while in Denmark the situation is completely the opposite. And this is also due to the fact that there is no clear definition of severe atopic eczema, which makes an accurate diagnosis more complicated. The symptoms are very recurrent and demand a high self-control and discipline. But we wanted to understand how these impact the life of patients and especially their emotions. So we developed a questionnaire, a new validated questionnaires to measure the emotional impact of atopic eczema on the patients. And what we found out is that 23% of atopic eczema patients do not have an optimistic view on their life with atopic eczema, and also that for 57% of them, itching is really unbearable. You can find more results on the report that is in your participant packs for your information. We also investigated about the economic impact of the disease. So atopic eczema accounts for almost 1,000 euro per year in healthcare expenses, and also it impacts the everyday necessity, such as personal hygiene. We have a plus 28% of expenses. But it's not only about direct cost, because there is also a high impact on productivity loss. We have seen that for more than 1 in 10 patients misses more than 11 days of work or a study per year. But now I want to leave the floor to our speakers for the session of today, and Erna will introduce them.
Please, our second speaker, in fact, the most important speaker is Idoia Moran. Idoia Moran. Yes, you have moderate to severe atopic eczema since you was 10 years old. So your story is also our aim for a better eczema treatment.
Well, hello everyone. Thank you for inviting me to this session, and thank you Global Skin and EFA for having interest in the heightened suffering in patients with atopic eczema. It is a pleasure for me to be here today, as I am myself a patient suffering from moderate to severe atopic eczema since I was 10 years old. Around 2006, I was diagnosed with asthma. And after my father was first diagnosed with cancer, then I developed atopic eczema. Since that day, I have developed several food allergies and other medication allergies. However, and despite the statistics, my atopic eczema is not genetic, since nobody in my family suffers from it. During this time, I've been through different stages in life, but my most important key to go through them is to try to understand my skin. For patients with atopic eczema, it's not longer just how your skin looks today, but how you feel about the state of your skin and your skin condition. Therefore, what are the emotional consequences of suffering from atopic eczema? Not only during the time of the period of the breakout, but before and after them. Before being at the strongest point of an atopic eczema breakout, patients go through many times of anxiety and stress moments, thinking about going through the same pain and itching over and over again. In some cases, even reaching the state of depression. During the time we suffer a breakout, we live with the same feelings, but they are added to impotence, shame, helplessness of being unable to do anything about it, and even social anxiety. Trying to cover ourselves from social opinion, or not doing any activities that we would normally love to do, thus limiting our social lives. Finally, after the breakout, we are in a state of a very strong emotional burden. In addition to the marks, discolorations, and modification of the skins, patients suffer a lot from insecurity. So my daily routine having atopic dermatitis has changed over the years, and that would depend on the different treatment. And so I would impact my schedule and my daily life, whether I was in a school, or if I'm working or traveling, just normal kind of duties for life. I even had to visit a few times the emergency room for immediate treatment due to the infection I was suffering in my skin. First thing I do when I get up is to look at my face in the mirror and see how many breakouts I have today in my face. And after that, I check the rest of my body to see how far I went last night with the scratching or the bleeding. I then start applying all of my skincare products, which always depends on the time of product I use with how my skin looks that moment, or how it feels. I missed school from having atopic dermatitis. I was sick in a different way than normal kids were sick, but I was still sick. I couldn't sit in class. I wouldn't want to be there. My skin was crawling to the point where I just needed to get out and go home. Now, I am a grown adult trying to have a working career, and there are days where I wake up and I have to cover up myself if I have to go to an interview because my skin is totally in a breakout. and I think that it is inappropriate for me to show up in front of professionals. It is also embarrassing for me to try to go to class with such an obvious rash on my face. I felt vulnerable and different from others. In terms of showering and bathing, it would be normally as quick as possible with colder water from 5 to 7 minutes, just so I wouldn't get my skin over-irritated or dry. And after that, I would have ointments all over my body, which I'm going to have all over my seats. And then, obviously, being a woman and wearing makeup to try to cover some of my rash on certain days, depending how bad it is, my atopic eczema that day would also take some extra time in my daily routine. So it really all ranges depending on breakouts. Obviously, it would impact a lot of other things like helping my mom or my dad at home with household chores or even social events. During the treatment, the patients ask us questions such as, is this novel or continued treatment harmful to my body? Or does it harm a man in the same way as a woman? Do I really need to change the treatment again? When does it finish? Or even does it finish? Or now what? So these are some of the questions that arise from the impotence of being patients who suffer from severe atopic eczema. So taking into account all the factors, the emotional consequences, and the diversity of cases of atopic eczema in our society, I think that a change towards an evolution of tolerance and understanding should be considered, which in my view only works through education and political policies. Education not only to the patients, but also to the society. Taking into account that patients need a better and alternative medications than the current one that help us manage and understand our skin, which is our key. And of course, these treatments should be affordable for all patients with atopic eczema in Europe. And as Bernard Arendt said, although atopic eczema is a skin disease, its consequences are way more than superficial damage in our skin. It also affects our minds, our love, our lives. We would like you to be aware of that, and we hope that now you are. Thank you.
We have to thank you, Edora. You gave a view what it really means to have atopic eczema. Most people don't know, and we know. Thank you. The next speaker will be Professor Marianne Moren. In September 2018, she moved to the Department of Pediatric Dermatology in Lausanne, where she had the opportunity to spend all her time on pediatric dermatology. Welcome.
Okay, so I'm a professional, and I was really interested in what you are all saying, because we know that it's really a very difficult disease to care for. My topic was why multidisciplinary care in atopic dermatitis. Well, first of all, atopic dermatitis is a disease that belongs to the atopic diseases and is associated to other ones. So it's good to see the patients with many professionals that care for the other diseases. And these diseases all have the same triggers. Moreover, like the first speaker already said, it's more than just atopic dermatitis. It has an impact on social life, on psychological development of, I care for children, mainly of the development of children. And finally, as doctors, we give a treatment, but the patient at home has to do it, and that's not so easy, so we have to educate the patients about what they have to do. So nowadays, in many countries, multidisciplinary care is more and more organized for atopic dermatitis, and I think there are two aspects. First of all, the multidisciplinary consultations, where we see the patient with all his diseases, all his atopic diseases with the same triggers, and we can do together the investigations and have a treatment plan for all the diseases. And then a second point is the therapeutic education, where the goal is to learn the patient about his atopic dermatitis, also how the skills he has to have to treat it, and we have also more attention to the psychological aspect of the disease. And in our society, where everyone wants to find answers to the questions on internet, it's more than ever necessary to have good guidelines for the patients, because there is a lot of information on internet, but also for professionals on medical databases, and often these are contradictory. So we need experts to guide us in this, and patients get a good treatment plan they can follow. So what are the advantages of multidisciplinary consultations? As said it before, atopic dermatitis is associated with other ones. So we can see them together with many specialists in one consultation and do the testing that are necessary for triggers, for example, together. So this results in one treatment plan. And then there's also the interest of provocation tests. If everyone has to do it on themselves, it's difficult, but if there is one unit in the hospital who can do it, it's better. So I give the example of food allergy because parents frequently think that flares of the eczema of their children is because of food allergy. But in this French study where atopic dermatitis patients were seen, and it were all patients where the parents thought that allergy was the trigger for their eczema, it could only be proven in not 1 in 5 patients. The evidence on the effect of diets is even less. There's only one study that proved that in patients where there is a proven allergy to eggs, that diet has an interest. Diets have risks. Patients can get nutritional deficiencies. Afterwards, they don't want to eat everything because they never learned it. And then when you follow diets, it can even be dangerous when accidentally the children have food that they didn't tolerate before. So we have to do good testing together, prick test, root tests, and then also exclusion and seeing that the eczema goes better, and a provocation test. And this has to be done. And this can then result in a treatment plan that is good for everyone, because now when children come and they have specific IgE for eggs, for example, the dermatologist will say, that's not important, you can eat everything you want, but a general pediatrician will say you have specific IgE to eggs, you don't eat anything because it can be dangerous. Whereas in most children, probably the right diagnosis after testing will be that they can't eat eggs when it's in the fresh, but they can't eat it when it's heated, when the tests are done. Another example is corticophobia. Dermatologists are more used to use corticosteroids, but pediatricians, they are more afraid to use it. For example, they don't use it on the eyelids. They stop very quickly. So that's also good that we work together and that they learn on this side from us. So when we do it together, then we can do more easily introductions of the food when there is tolerance, because there are less consultations. And of course, and I like this, we learn from each other. So the second aspect is the therapeutic patient education, where there is more a holistic approach of the patient, not only his medical condition, but also the emotional impact, yeah, like you said it already, and the social implications it has, and also the development of the psychological, the psychology of the patient. You can do it in individual sessions or also in workshops together with many patients, and it's best to do it with programs that are adapted to the age of the patients. It's especially interesting for patients with severe eczema or very chronic eczema. Instead of our usual consultations where the doctor meets the patient, he tells it something and he gets a treatment plan. Here the patient is in the center. He tells the doctor what his problems are, they listen, and together they try to find solutions for the problems, taking into account also what it means for the patient, the goals he wants to reach in life, etc. This implies many steps. First, there has to be a diagnosis. What does the patient already know? What are its difficulties? For example, does it affect sleep at night? What are its barriers to adherence? For example, corticophobia, or are the parents really professionally very active and don't have time to treat the patients, the children? And then you have to have a plan. What will we do? Improve knowledge, which knowledge, teach practical skills, and then see if the patient can cope with the disease and if there are problems with interacting with relatives or peers. And then there is the session where we try to have this all in practice. Here, patient-centered communication techniques are used with open questions and practical demonstrations of how creams have to apply to where, what a beginning lesion of eczema is, and how they can recognize complications like infection of their eczema. To help the patients at home, there are tools. The one that is very important in my view is a personal action plan where the different steps in the treatment can be written down, and then books about the disease to read at home. And that this works is in many studies already proven. The disease severity improves, the quality of life improves also, and patients can better apply their treatment. And this results in a better sleep for the children, better self-esteem, better social relations, because they feel better in their skin. And finally, and that's important for the authorities, it results also in a financial benefit. So in practice, it depends a little bit on the resources in the hospital and in the countries, how it is organized. In Lausanne, we are lucky because we do the consultation together, a physician with a psychologist, and it's 1 hour, so it's a lot of time we have. And then afterwards, there is also the possibility that the patients come in a workshop where they can meet together. In Leuven, we had a little bit less resources, and so we decided to organize group sessions for different group ages. But here also the patients were very happy because they could meet each other and also talk together about the problems they encounter. We had a pilot project, also very interesting, with experts by experience. Were patients with eczema, and they followed the patient. So the conclusion is multidisciplinary approach of atopic eczema in multidisciplinary consultations to have the patient all his diseases at once, and therapeutic education to instruct him how to treat his disease, and also to have a little bit more interest in what he feels, the psychological development. I thank you.
Thank you very much, Professor Marianne, for this clear presentation. It gave us good insight how it in fact, good practice can be. We're moving to the last part of this event. It will be the round table, and it will be moderated by Jennifer Austin. She's Executive Director of Global Skin, and Global Skin is Alliance, and it includes more than 150 patient organizations in 50 countries, representing, and that's really a lot, 60 diseases.
Welcome, everyone. Thank you so much for being here, and thank you for the introduction. I'm going to invite the panelists to come and take their seats, and I'll introduce them. While they're getting seated, I'll just mention that, yes, our name is Global Skin, and the long name is International Alliance of Dermatology Patient Organizations. And the 60 disease areas are all dermatology diseases, and we know that there are far more than that. We know there are somewhere in the order of 3,000 skin diseases, many of which are rare, and we do have quite a lot of representation of atopic eczema patient organizations in our organization, so it is something that is near and dear to us. So we're really pleased to be working with IFA on this session. So I will start by introducing on the my far right, Professor Johannes Ring. So he's the professor and chairman of the Department of Dermatology and Allergology of the Technical University of Munich. Welcome. And then we have Professor Dagmar Simon, who is the director of the Department of Dermatology at the University Hospital in Bern. Welcome. Thank you for being here. And finally, we have Professor Christian Vestergaard, who is associate professor at the University of Aarhus. Did I say that right? I was practicing with Professor Vestergaard in Denmark, of course. So welcome, everyone. So the topic that we have, and we have a short time, so we're going to be talking a lot quickly, moving through a few different subjects. So we're talking about shared priorities for quality of life-driven healthcare. So that's really putting the patient at the center. And I think we've had some very good presentations to help us understand how to do that. What we'll talk about in this discussion are some of the challenges and some of the potential solutions. And I want to make sure that we're also including our other speakers as much as we can, particularly Adoya, our patient, because that patient perspective is so very important for all of us. So I'm going to start, and I think I'll just ask you each to answer in turn to talk about the biggest challenge that you identify in your own interaction with patients who are living with atopic eczema. So at a high level, and if someone says what you were going to say, then add another one, because unfortunately there are many challenges. So we could talk about that all day, I'm sure.
Should I start?
Yes, please.
Well, atopic eczema is much more than a skin disease. It is an inflammation of the skin, but it affects their whole personality. And if you only look at the skin, you will not really be helpful to your patient. They are demanding in a very good sense. They want to be taken seriously. Many of their friends, they say they are hysterical, stop scratching, silly advices. If you know that itch is the sensation driving the person to scratch. And the psychology. Okay. Psychology is involved, not that they are psychiatric. I hate in the Anglo-Saxon literature, they are imprecise. They talk about psychiatric comorbidity. This is wrong. It's psychosomatic. There's nothing wrong in the brain. They are totally normal and healthy, but the psyche acts on the body and drives the skin crazy, and if the skin is crazy, it affects the mind. So this has to be taken apart. And we did this big study, you have heard, in 1,200 patients last year, measuring the burden of suffering. and we developed a new score, IESIC, Atopic Eczema Severity and Emotional Consequences score, with the patient organization. And the first author is a patient. And it came out that over 50% of well-treated patients were still suffering more than acceptable, had problems with intimacy, had impairment of their capacity to face life, felt guilty about scratching, so the life can be ruined by this disease.
Thank you. That was an excellent way to start this conversation.
I think all the dermatologists dealing with patients with atopic dermatitis have more or less the same experiences. And for me, it's really in the clinic to a challenge to understand the individual patient need, because sometimes the time is really short to see the patients and to get in such a close contact that they really come with all their problems. And I think this also has an impact to plan the therapy. So what we call shared decision making. And we organized at the clinic therapeutic education. And in that sessions, we have a little bit more time. Or we also have eczema schools. It's for adults. And it's amazing. They often have their atopic dermatitis for 10, 20, 30 years. How big the lack is on knowledge on atopic dermatitis and what is the appropriate therapy. And I think most of the stuff on atopic dermatitis, especially comorbidities and the burden, I learned in these eczema schools, not in the clinic, but in these schools, because then I meet these patients for 4 to 5 evenings, and they really come with their problems. They also discuss between each other how to deal and to manage the disease. And it's sometimes amazing what ideas they have. So it's not in the textbooks and it's not in the journals. So it's really their individual coping with the disease.
Thank you very much for sharing that.
Thank you. I might try to take a little different perspective, speaking more from an organizational, logistic point of view in these patients, because these patients are all over the countries. It's a very prevalent disease. And one of the things that I think really, and I heard it from both our previous speakers, is how do we really get the quality of care to these patients? What are the challenges? Because if you take the definition of quality of care, that is to get the best treatment to as many patients as possible, regardless of where they live, race, religion, gender, and so on and so forth. So I think that because already in the first presentation, we saw a large difference between, for example, Denmark and Sweden, because since I come from Denmark, it's something that I see every day, that in my country, it's often a diagnosis made by the general practitioner, whereas we could see in Sweden, it was more often the office-based dermatologists. How do we really get the treatment that is needed to these patients, and how do we see to it that these patients, if needed, goes to a higher and higher level of speciality? And that is really what I heard you also talk about. How do we bring the treatment to you, or you to the treatment? Sometimes it has to be in that order if we need a highly specialized treatment. What do we need in these different kind of centers? And that speaks into the concept of multidisciplinary teams, because that is really, really needed. As Johanna said, there's a huge psychological comorbidity in these, and sometimes we really need these other disciplines. We need other specialities, pediatrics, pulmonology, allergology, but we also need other specialty, other kinds of healthcare personnel, nurses, dietitians, psychologists, and we need this to speak this into how do we organize the treatment, because right now the treatment is, in my opinion, quite disorganized. So we need some sort of systematics in how do we do this.
I'm glad that you raised that, because in a session earlier today, which was a patient-oriented session of the EADV, there was talk about the fact that patients, atopic eczema patients in particular, seeing so many different specialists, and then they have to be the coordinator of their own care, which means they have to have a certain level of expertise that they very likely do not have. So that does put a lot of added pressure. So I'm glad that you raised that. Thank you. I'd like to give the last word to Adoya on this particular issue about challenges. Do you think that we've missed any really high priority challenges? And maybe just you can speak to the audience briefly.
Thank you. It is true that it is not coordinated at all. I am glad that Spain has a good healthcare, but I have to go to private doctors to see, because I don't coordinate myself to have a breakout next week or next month when I have my appointment on the public doctor. So,
Yes.
so yes, it is not coordinated at all. I have tried a lot, hundreds of treatments, and I have to decide by myself which one is best for me. I also have to go to psychologists, because as you all said, it's not only your skin disease, it's not only a skin damage, it's also your life damage. I have go through different stages in life, as I said, personal moments where I've been worst, where I've been better, but I think that the key is communication between the patient and the doctor. So,
thank you very much. Thank you. So I'm going to turn the microphone back over to the beginning of our group again, because I like the fact that I asked about challenges, but what many of you offered were also solutions. So there is hope, which is wonderful. And I think we've touched on some of the solutions. Maybe we haven't touched on how to get to the solutions, and that will come. But I'd like to open it up to our panel to share some other solutions that they're working on or that they have seen in action that have really worked for atopic eczema patients, and to focus it on the multidisciplinary collaborative approach. So, Professor Ring?
Well, right now we are in a time, very exciting time for patients with atopic dermatitis and allergies, because our understanding of the pathomechanisms has increased tremendously. We have learned a lot, and in parallel to this also new therapeutic strategies are coming up, which are very promising. And so I think in the near future, not too far, there will be totally new concepts and drugs available. However, we have to watch about side effects. We have to learn. They are on the market since 1 year, and we will not know about long-term effects. But it will be very exciting, and it will change our therapeutic regimen.
Okay, thank you. And I'm just going to mention that we have 5 minutes remaining, so I would love to be able to get through each of you, and I do want to end with Adoya if possible.
But I think even with these new therapeutics, which are really great, these patients still need someone who they can trust, who can contact. They still need like skin care. So this is what these drugs all do not or are not able to do. And I think out of this really huge choice of therapeutics, they need some help to choose the right one for themselves. And this can also change over time. So, but I think they should have some friends in medicine. It's not just a doctor, so they need really someone who they trust too.
Thank you.
And besides that, I think that our focus now in my department or in my clinic is we focus very much on of course, therapeutical patient education, because I think this is one of the keys, and that's actually also what I hear you saying. But besides from that, we would also very much like to focus on education of other healthcare personnel, like the private practitioner, which is the key person in our healthcare system. He's the one, or she's the one, who's going to coordinate all of this. We would like to focus on educating healthcare nurses in the schools, and also those who visit newborn babies. So all in all, we really need to focus on bringing out the message, because, I mean, here we are the experts, but we need also to make other experts, because every patient is the expert in their own disease, but we need to educate the rest of the healthcare personnel.
I'm glad that you said that, because I was going to give the final comment over to what I was going to call our disease experience expert, that is the patient. So Doya, maybe you can just give us a sense of some of the solutions that you think would make a difference in your life and the life of other patients. And I'm going to ask you to tell the audience behind you.
As I said before, I think that the best solution is to communicate. To communicate between doctors, between every specialist, and between patients. It is also known that those treatments are not always financially
possible,
affordable for thank you, for families. As you said, my mom for me is the person who I talk to every day, who I talk about my emotions, my emotional consequences about having atopic eczema. So yes, I think that we should work in communication between doctors and patients, and also education to not only patients, but also to people, because I don't want to walk through the streets and have someone looking in my face thinking, I don't know what. I want education to everyone to see, to look at me in just, it's just a disease. It's not contagious. How do you say that?
Yes.
It's just a disease. So education and communication.
Thank you very much. That will conclude our panel. So I would like to thank all of our participants.
Okay. I'm impressed by the event because at the end I felt the emotions and also the emotions of the physicians to give good, to change, to challenge and to overcome problems. And in fact, the only conclusion can be, let's go for a patient-centered, multidisciplinary and collaborative approach to improve the life of patients with atopic eczema and, in fact, of all patients. We are not alone. Thank you.